Welcome to the office.
Hi.
Hi, how are you?
Hi, Patricia. Welcome to the office.
Thank you.
So, your daughter's a patient here,
Yes.
and she's been telling me she wanted to bring you in,
Yes.
and today's a special day.
Yeah, it is.
It's her birthday.
Yes.
Happy birthday.
Thank you.
So you brought her for some happy birthday crack, didn't you?
Yeah, she did.
Okay, cool. But let's talk about what's going on. How can I help you?
Okay, I have
Tell
a
me.
problem with my knee.
Okay.
I did have a meniscus tear and
When
I had a
was that?
surgery. 2000, you can see a little scar. 2010.
Okay.
Uh-huh.
So, right knee pain?
Yes.
That's what you're doing here?
Yes.
Okay, that's it?
Well, I have pain all over. But
Let's talk about some major
Um,
things. Let's talk about top 3 to start.
Okay, so my hip, I have bursitis.
Okay.
My knee and plantar fasciitis, but I've been good for like the last 6
On the
months.
left side or both sides?
Both.
Both sides.
Yes.
Did they tell you what that is?
Yes.
Okay, because we're going to talk about that. You're saying, before we get into the feet, right hip, right knee.
Yes.
Okay, right hip, you're telling me bursitis.
Bursitis.
What does that mean? What's a bursitis?
They just say
I'm being a little
inflammation
funny.
of, inflammation of the hip.
Of the bursa in the hip. And you were good for how long?
Actually, I had to wear a boot
Okay.
because I couldn't step on it because it would hurt so bad. Yeah.
And
I was on crutches as well.
And the boot made it feel better?
Well, it kind of like just balanced the pain, but I don't know. They just gave it to me. I put it on, and
When was that?
I want to say like a year and a half ago, 2 years.
Okay. And is the pain still there?
Every so often it comes and goes, so I just got to be careful how I move or the way I walk or move.
Okay, so you're guarded. You're careful. You're guarded. You're guarded.
I'm very careful.
So
when I walk, I'm real careful the way I step.
Got it. Okay. And that's been for how long? A year
Probably
and a
the last year and a
Last
half
year.
to 2 years.
half? Okay. And which one is bothering you more, the knee or the hip?
Right now, my knee.
The knee.
Yes.
Okay. What else is going on? And I'm going to talk about all this stuff because it's all related. Okay.
I think my legs, my knees, and swollenness here.
Okay. Are you working right now?
No, not working right now.
Okay. You're home?
Yes,
Active? Are you getting movement?
Oh yeah, I do my 10,000 steps a day.
Oh, you do?
Every day, I have to. If I have 9,000, it's 11:30. I walk until I hit 10,000.
I like her.
before it's 12.
I like her.
Yeah,
Okay,
no.
so we got a compliant patient here. I like that.
Yes.
Okay, cool. All right, so we have hip, we have knee. Anything else that you want to share?
My plantar fasciitis, but it's good right now.
Okay.
And I don't know, but the last 6 months I've been experiencing a lot of leg cramping, and it's this leg.
Everything is right side.
Everything's the right side.
I'm going to tell you why today.
Okay.
Okay? But before we get into the x-ray component of your spine, we don't have x-rays on your foot. I do want to explain plantar fasciitis, okay? Because it's really important. I'm going to go ahead and let me grab my foot model, and it should make a lot of sense. So I'm going to explain the mechanics of the foot.
Okay.
Okay? Basic mechanics of the foot. We got 26 to 28 bones in this foot. We have 6 major misalignments that can occur with a sprained ankle. And most of us have sprained an ankle in our life. Okay? And you have, most of us have. And what happens with a sprained ankle, as I said, we can get up to 6 misalignments. And I'm going to lead it to the end result. Okay? So, the talus, this is the keystone bone of the foot. That's the ankle bone right here. Yeah, that's
You know
that
what?
bone.
I don't want to cut you off,
Please.
but I forgot one thing.
Tell me.
March 6th, I go hiking a lot.
Okay.
I found I fractured my tailbone.
Your tailbone.
March 6th.
Oh, okay.
That's what my
What did
doctor
they do?
told me. They
So
did
what
an
do you do?
x-ray, and they say stay off my feet, let it heal by itself.
For your tailbone.
Yes.
So what about you can sit on your butt, but you can't stand? Okay, I'm just trying to figure it out.
Yeah.
We'll take a look on the x-ray,
Yeah.
and we'll see if it kind of looks like what you saw.
Okay.
Did you see it?
Yes.
Okay, no problem. Anything else?
That's it.
All right,
That's it.
all
Yeah.
good. You can cut me anytime. It's fine. Okay. So go back to the foot. 26 to 28 bones in the foot, depending on what textbook you read. 6 major misalignments that occur with a sprained ankle. Starts everything in the talus. The talus is the ankle bone or the keystone bone of the foot. It connects the leg to the rest of the foot. Yes? Okay. Now, the talus can misalign. It can misalign, it'll go forward, anterior. It can go anterior superior, which means what? If we're looking at it from the side here, it's going to go forward and up. It can tilt on the inside like this. It can tilt on the outside. So that's number one. 85% of all foot issues I've seen as I was trained gets fixed by a talus. So we fix talus. If the talus is out, it creates problems for the rest of the foot. I'm going to explain it. The next bone that goes out after the talus is the fibula, and it rotates out. Okay? The next thing that happens is the calcaneus or the heel. It's all connected. So this goes forward. The fibula goes back and can rotate out. The calcaneus will go, I'm referencing the back here, will go posterior, will go back and lateral. Okay? This will start now, this fixation will create hypermobility in the foot. You're following me, right?
Mm-hmm.
Okay. Creates hypermobility in the midfoot. So the way we will test it is when it's stuck like this, when you bring your toes back, the one that's stuck won't go back as far. So we're stuck in this position. We're not able to bring it all the way back. Okay? Now follow the process. So talus, fibula, calcaneus. The cuboid, the outside bone, will go up. The navicular bone will go down. That hypermobility creates, or that fixation here creates hypermobility in the midfoot. This goes up, this goes down, and that bone right there, it's the second cuneiform or the middle cuneiform. That drops down. It's not supposed to. If you look at the shape of the bone, it's trapezoidal. It's a trapezoidal bone. Trapezoidal bones shouldn't go down unless there's hypermobility. That trapezoidal bone goes down and it starts to rub on that fascia. The plantar fascia is a sheath. It's a ligament. It's a connective tissue. And it basically starts at the heel and it's like a glove that covers the toes. If this bone drops down, we already have alignment, right? So the mechanics of the walk have changed. That keeps rubbing down on the fascia, and that's what irritates it. Long standing, if it's down all the way, it will pull. It will cause traction of the origin of the plantar fascia, and it can create a heel spur if it's been there long standing. Okay?
Okay.
That's my plantar fasciitis spiel, so to speak. So how do we fix it? Okay?
Okay.
So we'll test it all out for you.
Also, when I was a baby, my mom said I had flat foot. I'm from Costa Rica. So in Costa Rica, they gave me special shoes for 2 years
Okay.
of my first 2 years.
Were you C-section, do you know? Normal
No,
birth?
I was normal.
Normal birth, flat foot.
Yes.
Flat foot when you started walking, obviously,
Yeah, that's
right?
when they found out when I started.
Okay, and here's how we're going to test the flat foot. There's 2 types of flat feet, or flat footers. One is a structural flat foot, one is a functional flat foot. And here we're going to test it right now for you.
Okay.
Stand up, please. And you can look at her arches. And she has an arch hiding in there, but it is flat, okay? I can't get my finger in there. Have a seat. Cross one leg over the other. Okay, now come over on this side. And look, relax the foot, let it hang. You have an arch. So this is a functional flat foot. This is not a structural flat foot. Where does it come from? Talus.
Oh.
Where does that come from? The back. See? So we're gonna go over all that today.
Oh.
Okay? Cool. Anything else?
No.
Okay. Anything you want to add?
Not yet.
Not yet? Okay. How about we do this? Let's go over your x-rays. There's a lot of stuff we need to go over.
Okay.
And then I'll examine you and let's figure out where we're going to start today.
Okay.
You have any questions along the way, you stop me.
Okay.
Okay, you're uncomfortable with anything, you stop me. This is a picture in time. Tells us how you've evolved from birth. We have 24 bones in the spine that move. We have 23 discs in between that allow the movement. And then we have the foundation, which is the sacrum and the pelvis. The work that I do here is based on what we call the level foundation principle, which states in order to have a stable building, we need a level base and foundation, just like your home. Yeah? So the first thing we need to look at, and you're saying everything is right-sided, it kind of makes sense now why. And before we get into that, we're also going to talk about digestion. What's that? What's surgery? These are staples.
Yeah, I had a hernia.
Hiatal hernia up
A
top.
hernia repair.
Okay.
Um,
You had something down here too.
I had my intestines.
Okay.
First, I had a hernia repair,
Right here.
and then I had it was appendicitis,
Okay. No.
and I had complications. I had to go back in the hospital. They had to reopen me
Okay.
because when they did the appendicitis repair, the doctor left intestines. It plugged up or something, and they had to go back in and cut the intestines and repair it.
Got it. Okay. Now,
I had 2 C-sections.
you have.
I
Okay.
had 2 C-sections.
No problem. So we do need to talk about your digestion. It is one of the big components of your healing.
Oh, I had gastric bypass.
That was the next thing I was going to ask.
Okay.
When was that?
2011.
2011. 24 bones, 23 discs. This is the foundation. We can see we need to have a level base foundation. Do we have a level base and foundation? No, we do not. You can see the right side is shorter, the left side is higher. This has been like that for a while. It created this curvature, right? Because it's down on the right side. And the body has compensated over the years. We're going to also talk later about your digestion. I do want to point this out right now. This is a lot of undigested food in your colon. Mm-hmm. So we're not absorbing and assimilating the nutrients. This all starts from the stomach. If you want me to give you the clinical diagnosis, so to speak, it's called hypochlorhydria, low stomach acid. And that starts all this other stuff going on here. Okay, we'll talk about it later. So I want to go into your foundation, and I want to look at the numbers, and this should start to make some sense here of what's going on. So we need a level base foundation. Do we have it? No. We have, and I'm going to explain the numbers now. We have an ASIN on the left. We have a slight, the rotation is not significant here, okay? But you can see she has a 7 millimeter drop of the sacrum on the right. This is an old tailbone injury. So there's an old tailbone injury that started the sacrum to be bent, and that's how the mechanics or everything shifted. You're telling me right. Let's look at it mechanical, simple, okay? This is the pelvis. The femur is sitting in the pelvis. Let's show you on the spine.
When you say old tailbone injury, you mean
She fell on her butt.
prior to March?
Oh, this is an old one. Yeah, no, I'm talking about back when she was a kid. Okay, this isn't March. Because this drop right here and a 7 millimeter drop doesn't, it can still happen, but if she fractured, when I say tailbone, I'm saying sacrum here. You're telling me tailbone down here. Okay? I'll go back to this x-ray so we can see. This is the coccyx here. Okay? I would like to see the x-ray or report that they're saying you fractured your tailbone. I do see something off here, right there. Okay? I'm not in that area though. It's a little dark. Right here. Just listen, see. But why don't you bring me what you have? What I'm talking about is this. If we look at the tailbone or the sacrum, it should be a smooth arc. You got this little one, but this nub right here. This isn't the old tailbone injury. This is a callus that formed. That's not from March.
Okay.
Okay? So, let's go back to this. Right over here. Now, if this is the foundation, okay, and this side is dropped down like this, right? It drops down, it creates that curve.
Yes.
Now, the femur sits in here. The femur sits there. Let's go to the numbers. ASIN. This goes up and in. If this goes up and in, that means the right side went down and out. If this goes down and out, what does it do to the angle of the femur? It's going to rotate it forward. And it's going to change the angle of how the femur attaches to the tibia here. And now we have the alignment issue, so we have uneven wear and tear. Right? Just like the car. If the car is out of alignment, the tire wears a little uneven. So your thing wore out a little uneven.
Yeah, because when I lift my knee up and down, you could hear my bones cracking.
Pop, 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 pop.
Yes.
You still have your meniscus though, right?
Well, they did surgery, so apparently it got repaired.
Okay. Not a problem.
It wasn't a knee repair. I didn't get my knee replaced.
It was just arthroscopic.
Yes.
Got it. So they
Yes.
just cleaned it up and shaved it up.
Yes.
Not a problem. Okay. Do we understand though? We need to get this thing up on the right side. We have a measured difference of 12, actual difference of 9. We have 5 millimeters of rotation. So let's put this together. Your left side goes up and in, so it's favoring to the left. The right side goes down. So when she's walking like this. We're supposed to go through both joints equally this way. Okay? And this is what started the process of your knee, by the way. Cool?
And when I get a pedicure, when they're doing my pedicure, I always get the sharp pain right here. So I gotta tell the lady, hold on, let me adjust my hip.
On the left side, right?
On the left side,
Yep.
yes.
And you understand because you're tilted.
Yes.
Got it, okay. So let's continue then. So we have the foundation. We're gonna probably start somewhere in the tailbone. I don't see us working in this area. This is all compensation here, okay? As we get up here, so what is the body doing? It wants to go this way. It compensates to come back to neutral. From here, it wants to go back out again. So the body is going through a lot of compensation, all from this tailbone injury and short leg on the right side. Does that make sense? You follow? Yeah? Okay. All right, now as we go up, we have... So all this is kind of the body trying to fuse. Okay, this is calcium. It's trying to fuse again. This all goes back to instability. Instability. As we go up the spine, your upper cervical is decent. Jaw is decent. I'm okay with that. Let's go over this one, the side profile. This is going to tell us a lot in terms of your posture, okay? So even with the short leg on this side and the imbalance, whatever, let's see how the body dealt with it. If we look at the posture, we're running the line here. This should go through 7 and 1. Okay. So it should be going through here, C2, and through C7 at the base. And what this shows us is that your upper body is behind slightly your foundation. So the muscles up here are working a little overtime. You know, you get a little stiff and you get that pain in the shoulders when you're sitting or standing a long time. And the goal would be is we want to see if we can get this whole posture forward. And if I do my job, then it should hurt to slouch.
Okay.
Okay? All right. Questions there?
No questions.
Questions? Okay. We're going to get started then. Now, there's other stuff. But this is where we have to start. There's stuff, okay? And you've dealt with it. You've dealt with it. You've dealt with it. So going back here, our goal is we're going to start somewhere in the tailbone, hopefully, maybe the pelvis, and we need to get this bend, this kink up. I don't know that we're gonna fix that. That's not my intention. My goal is let's get the pressure off so she can get her mobility. As you get your mobility, we can make further determination or suggestions later. Right now, let's get the pressure off.
Okay.
Okay? Shall we?
Sounds good.
Go ahead and walk to the nervous system poster. The best you can, please. Good. Turn around, and you're going to walk several times, okay?
Okay.
Let's do it. A lot of swelling in her body, and the swelling is all part of the digestion issues. We're in for some good changes, I hope. And you ready for this, right?
Oh, yes.
You've been adjusted before? Keep walking.
Yes.
When was your last adjustment?
Oh, about 20 years ago.
Oh, wow, okay. So as she's walking, you can see she's a little guarded in her walk, and as she even said in consultation, she's mindful of her walk. Let's watch here the dimples. And there is some movement in the dimples, but there's more shifting than there is up and down movement. Okay? One more time, please. Okay, yeah. Do you swing your arms when you walk or not really?
Not really, I don't think so.
Okay, can you march in place? Take 2 steps back first, please. And let's have you march in place. My hand is right here. Close your eyes, keep marching. And she's off. Open your eyes.
Did you hear my knee popping?
No, but did you see where I am and where you are?
Oh.
Have a seat over here, please. So the popping is what?
My knee?
Why does a knee pop?
I don't know.
Because it's out of alignment. Make a sense?
Yes.
Sit back for me, please. And let's run the meter on the back and let's figure out where we're going to start today. Head down, please. Starting at the base of the neck. And the first thing we're getting, 15 points. C7. And as we go up, not really. Starting at the base, going down. Now, we know there's digestion issues going on there, okay? When we're dealing with digestion, we have to make sure you have the appropriate stomach acid. And where does the acid production in the stomach come from? It comes from these specialized cells that make it. And they get their power and information from the nervous system. And then you need a couple of things. So hydrochloric acid, hydro, water, chloride. Chloride from salt, sodium chloride. And then the cofactors are zinc and B1. And a couple of other things too. But you need to also have the hormone called gastrin. It's a stomach hormone. And the body will only make as much HCl as you have serum gastrin. So you can have all that good stuff, but the gastrin can be low. And serum gastrin should be greater than 50. So someone who has a serum gastrin less than 50 will always need some sort of HCl supplementation. It's low. It's low and it's old. If it was new, it would be a lot more pressure. Right there. S3, S4. S3, S4, around T6, T7, and around C7. Next thing we're going to do, let's go ahead and check the movement of your pelvis. Feet together. Are your feet touching?
Now they are.
Okay. Are they touching the floor?
No.
Scoot forward, please, so they are.
Okay.
Good. Feet together. Open and close your knees with your feet touching. Good. Left side only. As she does the left, little movement of the right. Right side only. And same thing when she does the right, there's a little movement of the left. They're both a little fixated. Scoot back for me, please. Now we got a hunt, okay?
Okay.
Static palpation. Head down, please. And let's run the fingers down the spine. And you can see the swelling starts. This is swollen, but more of it starts right there. This is swelling. This is swelling. This is swelling. 1, 2, 3, 4, 5, 6. More tender when I push here at
Yes.
7 or
Yeah.
at 6?
7.
7. 8, not as bad.
No.
7. Ah, the sugar butter. C7, head back and down. T1, back and down. C7 to the right. C7 to the left. T1 to the right. T1 to the left. T1 is moving. 7 to the left. 7 to the right. 6 to the left. 6 back. 6 to the right. More tender when I push there or there.
The first one.
First one.
Right.
Ha! But I got a monkey wrench in this. The research doesn't actually support point tenderness in the cervical spine with the cause as the cause of fixation. We can find pressure and we can get point tenderness on the spinous down in the lumbar spine, and in the thoracics we can correlate that. There can be many other factors causing spinous tenderness in the cervical spine. So we can't actually use that to justify the adjustment. Like that? We're getting some knowledge on your visit here, aren't we?
Yes.
I'm playing a little bit too. Okay. So I'm looking, let's feel which one is stuck. This one, this is T2. That moves. T1. C7. C7's not moving. C6 hurts though when I push, right?
Yes.
But C7's the one not moving. That's the one we're building. C7. C7, T7. Ooh. Now the fun part. Let's check your low back. Back slowly towards me, please, ma'am. That's 5. Little tender.
Yes.
Let's go down. S1.
Oh, yes.
Yeah. L5. S1. Yes?
Yes.
Lead with your back, not your head, please.
Okay.
S2. S3.
Yes.
S4.
Yes.
This is the coccyx or the tailbone, probably they talked about right there. Yes?
Yes.
Okay, we ain't touching that one. We here.
Oh, right there.
S4. S4, T7, C7. Are you ready for me?
I'm ready.
You got questions?
No.
Okay, let's get started.
Should I take a mic?
I have a question.
Yes, ma'am.
C7's not moving, but the pain is in C6.
Correct.
How does that happen?
It's compensated. C7 is the one that's stuck. C7 is where the pressure is. It could have been it can be long-standing. Let's go over this one more time.
So that's what means. Yeah, I do have a lot of swellenness on my legs.
Yeah. So if you look here, C7 is there. C2, C3, C4, C5, C6, C7. C6 is swollen, but so is C7. Yes?
Yes.
And it's tilting back. This is extension. In extension, they should move back. Didn't really move, did they? But when she goes in extension, she actually pinches C5. They all kind of tilt back. But when we go into flexion, look, C6 is tilted, yes, so C6 is part of it, but C7 is where it starts.
Mm-hmm.
Right? If this one is tilted and this one is level, then we would have gone with C6. And down the road, C7 gets fixed. Maybe it fixes C6. Maybe we have to work on it. But we're not working on two segments. If we have one bad joint over another bad joint, it doesn't make sense to adjust one bad one over another bad one. So C7 is where we would start. Okay?
Okay.
Cool?
Good.
Let's go over here and do it over here. Hi. Breathe. And out. So we need to come through and torque. We got to bring that right side up. Home run. Woo! You did feel that, right?
Yeah.
Wow.
Oh yeah, I felt it.
Yeah. T7. Come on. That's so tight, bugger. Gotcha. You doing okay?
I'm good.
Okay. Now let's do C7. Chin up a tiny bit. There we go. And down. I'm holding the back of your head with my upper hand here, okay? Gotcha. That's a home run, lady. Hold my hand, please. Can you see without your glasses?
Yeah.
Okay.
Little
Come
blurry,
off
but I can
slowly.
see.
March in place first. March in place. March in place. Okay. Now I want you to walk it off a couple of times, please. As you're walking, tell me if anything is different. There are your glasses. Da-da.
I feel like I could balance myself better.
Oh. A little different, yeah?
Yes.
Keep walking, please. Good. Come back over here, have a seat. Let's continue. Starting at the base. C7 is clear.
That actually felt good.
Good. It looks brutal though, right? People say it looks worse. Little spicy, maybe a couple of the adjustments. Mid back is clear. Cero. No nada. Come back slowly towards me. All the way back, all the way back. Don't be scared. Don't be scared. Forward. I'm going to hold your neck. Come back all the way. Don't be scared. Do you remember 5?
Yes.
How's it feel now?
Not that painful. I just feel your thumb going in, but not the pain.
S1. S2. S3. The matrix.
Oh yeah, I feel a difference.
You just had the red pill. No nada. On your back, let's work on your foot now, please. Let's continue. We said we're going to work on the talus to start, right? So, we're doing the right foot. How's your knee? Let's see.
Actually,
Yeah, what?
before I couldn't put my knee straight, flat on the back right here,
Okay.
and now I could.
But you didn't tell me that.
Wow. Yeah.
It's just stuff, right? Symptoms.
Yeah.
Symptoms.
And I always thought it was because the surgery, so I used to baby it a lot. And
Guess what happens today?
Don't baby it.
No guarding, okay? You'll be mindful, but you won't guard. You won't need to.
Yeah, every time I walk, I'm always on the guard. Always. Looking down where I'm stepping.
You don't need to do that today. Okay?
Okay.
Let's work on the scar tissue first. And I'll do it to your tolerance, okay?
Okay.
Oh, juicy. Oh, that's juicy, lady. She's juicy today. Oh, yeah. We'll work for juicy. That was so 2000. We'll work for juicy. 5, 4. Can you deal with
Okay.
it? Can you deal with it? Yes?
Yes.
Okay. Tell me if to stop if
Okay.
you want, but I got to do as much as you're going to allow me to. Okay, ma'am?
Okay.
Please. Happy space, happy place. Happy space, happy place. Breathe. You're holding your breath. Breathe. 5, 4, 3. There.
Okay.
Got it. Now let's set the ankle. You gave birth, right?
Oh yeah, I've given birth.
Wasn't that bad.
2 C-sections. Oh no, I could tolerance this.
Talus, AS talus, medial tilt.
Oh.
Nice. Can you come help and hold? Hold her here. So we're on the talus, medial side. Lift it up, lift her leg, lift, up. That's it. Got it. Now I use the board for the drama. Turn to your left side, please. Other side, please. Then we have this one. We're doing the arch. And now the fun one. Stand up, please. Go walk it off once, and I got one more thing to do.
Okay.
You can tell us from just that what's different, okay? Little different, yeah?
Yes.
Face down over here, please.
Okay.
What is it, right foot again?
Yes.
So look, coming off the third digit here. This is the third digit. Follow the metatarsal. And that's it. You feel good?
Mm-hmm.
You feel good? Feel it. Come here, feel it. Starting from here. Relax. That's what's rubbing. That bone, that trapezoid bone I was telling you about. Gotcha. She needs to wear socks, okay? To sleep even for the next 2 minutes. You're all set, ladies. Sit up, and we're gonna get a buff and polish now.
Okay.
Yeah.
I could never put pressure on my knee, and now I could.
Let's try.
Yeah.
Can we try something a little different?
Sure.
Can I have you sit on the floor over here against the door?
Yes.
You take your time, please. Okay. And then I want you to sit and put pressure on your knees, please. So kneel on your knees.
On my knees.
Please take your time.
Okay.
Take your time. Put pressure.
Oh my God, I couldn't do this before.
So you couldn't put kneel on there, right?
Nothing.
Okay, let's come up now, please, slowly.
Okay.
I'm gonna let you do it yourself.
Okay. Wow, I do feel a difference. Yeah.
Okay.
Thank you so much.
Keep walking.
Okay.
Oh, we just getting started. Now the buff. Some musical chairs there. Ears.
Oh.
Shoulders. Let me do the work. There you go. Let me do the work. That's it. Stand up. That was your happy birthday crack today.
That was.
She gave you you got the happy birthday crack. Squeeze.
I never knew ears could crack.
Squeeze. Squeeze. Come over here, please. Squeeze. Squeeze. So you got a strong grip, yo. Thumb. Thumb. That's where we're going to start, man. Your homework with me is simple. Movement. Up to the 10,000 steps. You already told me you're doing it, so that's done. Water. 3 to 4 liters a day.
Okay.
You go to the bathroom a lot in the beginning. That's life.
Yes.
Okay. Ice the areas I adjusted. For knee, we're going to add in another thing. Pedaling backwards. You have a bicycle at home?
Yeah. Yes.
You can sit on it, on the bike against the wall, pedal backwards, or you get one of those pedal machines for her. Okay? And it's something you're going to want to do every day, 5-10 minutes.
Backwards.
Backwards, no resistance, just motion. It's good for your knee, it's good for your hip.
I also have a elliptical machine. Does that work or no? It has to be back.
You know, you can do that too if you want. I'm just trying to keep it simple. I don't want resistance when you're doing it. So if you have an elliptical at home, no resistance, and just go backwards,
Okay.
5 or 10 minutes. Okay? Then you can go forward. When you're doing your cardio on your machine, I want you to think of a 2-to-1 ratio. Every 10 minutes forward, 5 minutes back. That's your pattern. okay,
10
for
forward,
rehab.
5 back.
Okay?
Okay.
So you have water, walking, ice.
Okay.
Okay?
Sounds good.
Welcome to the
Thank
office.
you so much.
You're welcome.
Thank
dear.
you.
Happy birthday.
Thank you.